Welcome. My name is Pamela Dias, and I will be speaking about deployment, psychology, resilience in a time of war, service member, spouse, and the children. I'd like to give a brief overview of combat stress. First, war can have a powerful psychological impact on the female service member. Combat can lead to distress or even post-traumatic stress disorder, which is marked by extreme worry, re-experiencing of the event, and avoidance of things reminiscent of the trauma. Also, prolonged separation from family and friends can also cause problems. How do women react when they return post-deployment? And how do they treat their spouse after returning? Although many service members and their families demonstrate remarkable resilience in response to the service member's deployment to a combat theater, many others do not. I'll be speaking about two experts. First will be Dr. Stuart Winkler. He's a cognitive behavioral psychologist. He's located at the Naval Medical Center in San Diego, California. Dr. Winkler graduated from Emory University and received his doctorate in counseling psychology from the State University of New York in Buffalo. Dr. Winkler completed his internship at the Alpena VA Medical Center in Los Angeles and completed a 2-year postdoctoral fellowship in clinical research in addictive disorder. Next is Dr. Anne Franklin, a deployment behavioral health psychologist. Located at the Center for Deployment Psychology Uniformed Services in Bethesda, Maryland, Dr. Franklin graduated from the University of Florida Department of Clinical and Health Psychology and completed her training in chronic pain assessment and treatment. Dr. Franklin has received an award for excellence in psychotherapeutic counseling. First, Dr. Stuart Winkler. Dr. Winkler spent 3 years working for the Navy's Fleet and Family Support Program, where he provided counseling services to military members and their families. He provides assessment and cognitive behavioral treatment to patients with traumatic brain injury, or TBI, and combat stress disorders, while providing counseling services to military members and their families. Given that there are close to 2 million children of active duty military parents, with 44% under the age of 6, it is reasonable to suggest that many families are directly and indirectly affected by the trauma of the war. Dr. Anne Franklin. Dr. Franklin provides training for treatment to the men and women of the armed forces by using evidence-based practice with an emphasis on post-deployment issues. Dr. Franklin's treatments include deployment-related mental health issues, the assessment and treatment of PTSD and depression, and the impact of military life on the family. Women's increased exposure to combat also raises the question of whether there may be gender differences in the mental health consequences of combat exposure. I'm going to compare cognitive behavioral psychology to behavioral health psychology. Dr. Stuart Winkler is a cognitive behavioral psychologist. He does motivational techniques and relapse prevention skills and components of stress management. Dr. Anne Franklin is a behavioral health psychologist, and she does intervention for chronic pain, treatment of post-traumatic stress disorder or PTSD, and the management of depressive disorders. And together, they provide services for distress, trauma, post-traumatic stress disorders, and family issues. I would like to say thank you for listening to me talk, and if you would like any of these references, please let me know.